On Blues Radio International, I'm here again with our good friend, Dr. Janice Johnston. Thank you for joining us today.
You're welcome.
I would have to start with the one question that all of us who love and care about you have, and that is, how are you? That's the first question.
I'm doing great. I'm healthy, so start with that. Things have settled down into a pattern now, and I really do feel like things are going pretty well in terms of the stress level, at least for me.
I'm glad. Now, we've really seen quite a change in the past month. It took 30 days to have the first 5,000 deaths in this country, and then the second 5,000 deaths happened in fewer than 5 days.
Hmm.
It's startling. We've got the
It
third
is.
highest rate in the world now. What are your thoughts on the current situation?
Well, I think it depends on where you live, honestly. We can see hot spots, such as in New York City, where it just seems absolutely devastating. And then you come to other parts of the country, like where I live, where we've had 65 deaths, and any death is very sad and unfortunate. But certainly it's just not to the same degree that's happening in certain parts of our country. Whether that it probably has to do with population, and how densely people are together, how quickly communities started social distancing and started putting into effects to try to make us all safer. So um, I think social distancing is working. I think that we can see the effects of that right now, and hopefully we won't have to do it for forever. Um, that's the part that I'm not really sure that people know right now, is how long we're going to have to kind of go through all these exercises, which is this really, really stressful part.
I see people optimistically scheduling things for early May, and I'm starting
Yes.
to think as we sit here in the second week of April that may be very unrealistic. Do you have any guesstimate and timeline that we ought to be thinking of?
Well, I'm hopeful that at the beginning of May, at least some parts of the country will start to get back to more normal. Whereas other parts of the country where there's such a volume and hotbed of infection that's going on, that might last for quite some time.
How good is the data do you believe that we have? Because our confirmed cases, that's a funny number. We say confirmed cases, but that means a lot of different things, and it depends on who we've tested, obviously.
Right, right. So I can tell you, the current recommendations for testing is really it's limited to people who are in the hospital, people who have some comorbid conditions, those in the healthcare arena. But if you're not falling into one of those categories and might just have milder symptoms, we're just telling you to stay home right now. So we're not bothering to test, because honestly, the recommendations in terms of what we're telling you to do doesn't really change whether you're positive or negative anyway. So
What
yeah, so I think the numbers are probably grossly underreported.
we last talked now, I guess 9 days ago. What have we learned about the coronavirus in your treatment of patients on the front lines in that time period?
Well, I can tell you, I have not had a positive case in 8 days now.
Mm.
We've continued to test certainly our volume of patients that we feel is appropriate for screening. I do feel has started to go down. Yeah, we haven't had a positive case come through our doors since last Monday. Um, and all of the positive cases that we've had are all completely recovered. There were two that had to go to the hospital, but they were not intubated, or they were just treated either with oxygen, antibiotics, those kinds of things, and then released. But they all are doing okay. One's sort of lingering right now, but I think she'll make a full recovery.
One concern that I've heard expressed, and we all have read in the media, that the impact is racially very disproportionate. Is that a matter of healthcare availability, or is there another reason for this?
Yeah, I've heard that, on the news just recently. And I mean, certainly, if are you talking about more African American? Is that what you're talking
Yeah,
about?
I mean, for example, New
Okay.
Orleans, according to the latest that I saw, 30% of the population is African American, but they've got a 70% rate there, and it's highly
Right.
disproportionate to their
Right.
representation in the population.
Yeah, well, certainly the African American community has a higher incidence of certain conditions, chronic conditions, hypertension, high blood pressure is super, super common, and it doesn't have to be as you get older. We see patients in their 20s and 30s that have hypertension and also diabetes. Certainly there just may be some of that where they're getting sicker just because they do have these chronic conditions that are going on. Um, it's hard to say if access to care makes any difference or not. I would think not in this particular arena because doesn't matter who you are, right? Anyone can get it. So I think time will tell as to what that all means, and whether it's reporting or screening availability. And certainly in New Orleans, I think because there are more cases there in general, there's more testing capability that are in these areas.
You gave us some very helpful ideas the last time we talked, just about growing herbs and things like that. What are the things, and I think it's important that we all do what's within our power. You said stay home. That message is very clear. What
Yeah.
is within our power to do in terms of our own health routines, things we could take? Unfortunately, there's been a run on some things like Tylenol and hydroxychloroquine, but what are the proper things we should be doing with what we have or what we can get to prepare to weather this?
Sure. Well, definitely making sure that you're keeping adequately hydrated, I think, is really important. Getting some vitamin C, whether that be from oranges, lemons, limes, that kind of thing. Getting some emergency, that little powder that you can add to your water. That's very helpful. Even just putting a little slice of something in your water can give you a little bit of added vitamin C, and certainly vitamin C comes in tablet form and in multivitamins too. Making sure you're getting enough sunshine, because we know that sunshine is important not just for our mental state, but also to make sure that our bodies are getting adequate production of vitamin D. If you live in a part of the world where you're not blessed with adequate sunshine, taking vitamin D supplementation can definitely boost your energy levels, and it's just important for overall health too.
What about those of us who are getting food delivered at home and trying to obey the stay-at-home order? Many people have switched to, and I'm not talking about takeout food, but there are now services that will shop for you or bring produce. What precautions do people need to take when they get deliveries of food, for example, that's been handled by other people to minimize the possibility that they'll bring it into the home or ingest it?
Yeah. So, I mean, with any sort of fresh fruits and vegetables, anything like that, you're always going to want to wash those anyway, whether it's coronavirus time or not. It's always recommended that you would wash down things before you would eat them. Even just wiping down cans or bags and things like that, I think is probably not a bad idea. Um, is it absolutely necessary? I'm not sure, honestly. I can tell you that I haven't done it, but I'm good about washing, my fruits and vegetables for sure. Um,
How about boxes? We get boxes of things that people have ordered from online services. They're delivered by people who may not be wearing protection. Does it
yeah,
live on corrugated cardboard? Do we have to spray that with Lysol before opening it? What's the proper way to protect
yeah.
ourselves?
So we do think that the virus can live on surfaces for quite a while. So it certainly is not a bad idea to wipe down things, certainly unknown things that are coming into your home.
How is your staff holding up under this? I know you said you're into a routine now. You oversee 200 plus professionals. I'm sure the emotional burden and toll on them is great. How is that working?
Yeah, so it's an up and down kind of thing, and I think we all take turns in terms of being super strong, and other times it gets to you. we worry about being exposed to patients and then taking that home to our family. That's a real concern for us, especially when people can be carriers of the disease and we don't know. And we're out there every day. Certainly we are taking our precautions, wearing masks, gloves, eye shields when we go into a room with someone sick. But I do think that my staff feels much safer now that we have very easy to follow protocols. And a lot of my staff is working from home now too, virtual medicine, even though we've been doing it for so long, probably about 8 or 9 years, probably we've been doing virtual medicine. So that, of course, gives you the luxury to not have direct exposure at all.
All my doctors are making that transition in a matter of
Yeah.
weeks, and you've got
Yeah.
the depth of experience and the mechanisms to do it the right way. So it's
Yeah.
really a blessing that you started on this early.
Yeah. We joke that we were doing telemedicine before it was cool.
Yeah, yeah.
Yeah.
Well, that's
Yeah, it's funny, when we started it many, many years ago, a lot of the professionals that worked with us had a great discomfort with it and just didn't feel like you could do a good job. And there's so much that you can do through a virtual visit. It's awesome, and so thankful that we do have the capability to be able to do so at this time.
now there are attachments you can get for a phone that allow you to monitor certain health functions. Are they useful to you in telemedicine, or is this a gimmick that just is there to please consumers?
So it's helpful for me in a setting where, say, I may have an employee-based clinic, maybe in a warehouse or something like that, where I may have a health aide on the ground who might be able to place a stethoscope on somebody's chest or, a light in someone's ear or in their eye, down their throat, that kind of thing, where I can actually examine the patient. That's super, super helpful for me. I think that the main thing right now that's helpful is when we call, do you know what your blood pressure is? That's great. If you know what your temperature is, and not just say I have a fever, but actual know a number. And a lot of people don't have thermometers, and they're super hard to find right now. I had one patient who told me that he used a meat thermometer to take his temperature, which I thought was pretty ingenious. I'm not sure that it was accurate or not, but yeah, people are being, using
That,
their heads on that. And then the other thing that's really super helpful, especially with asthmatic patients or people with COPD, lung issues, is to know what your pulse ox, and that stands for how much oxygen is in your blood. It's just a little thing that you put on your finger. They're pretty cheap. I'm not sure if those are out of stock on Amazon or not, but they're usually run about $20, $25. And it's a really helpful tool when somebody has that at home.
yes, and they are available. I've seen them recently, and I actually purchased one. But people should know when you say it's a finger test, we're not even talking about a finger prick like a
No.
diabetes test. This is literally just a soft clamp that sits on your finger. So it's a painless piece of information your doctor may find very important if you've got
That's right.
respiratory illness.
Mm-hmm.
Well, I hope that people watching, if they've got kids at home, will bring them in because they can see a true action hero. I can't thank you enough for joining us, for the patients you're treating physically with your hands, for the patients you're treating through telemedicine, and for all the patients you're helping by sitting down with us. Thank you very much.
Thank you, Jesse. I'm going to be meeting with some children soon. I did an online question and answer with some kids this morning. Going to be doing that soon again with some first graders too. So I'm looking forward to that. Those kinds of things are what brightens our day. It makes it easier to do our job.
Well, you've made our day and our night. Thank you so much, and we'll look forward to talking to you and catching up with hopefully even more good news the next time we speak.
All right. Take care now. Bye-bye.
Thank you, Janice.